Hello guys, today we are going to discuss about a test called Clostridioides difficile and C. difficile toxin testing. Use of the test to detect the presence of an infection caused by toxin producing Clostridioides difficile. These tests detect the presence of a Clostridioides difficile or toxin produced by C. difficile in a fresh or a frozen stool sample. C. difficile is a bacterium that is present in the intestine of up to 60%, 66% of a healthy infants and 3% of a healthy adult. C. difficile is one of the group of a bacteria that usually inhibit the colon and as such are called normal flora. If something happened to prevent the growth of other normal flora, such as broad spectrum antibiotic therapy, C. difficile may overgrow and disrupt the balance of a bacteria in the colon. About 75% of C. difficile produce two toxins, A and B. The combination of overgrowth and toxin production can cause prolonged acute diarrhea, and the toxin can damage the lining of the colon and lead to the pseudomembranous colitis, a severe inflammation of the colon. C. difficile is a major cause of antibiotic associated diarrhea in the hospital, affecting as many as 20% of those who are taking antibiotics for other infection. While C. difficile is frequently carried by infants, it doesn't usually cause diarrhea in this population. The risk of being affected increases with age and is increased in those who are immunocompromised, have acute or chronic colon conditions, have been previously affected by C. difficile, or who have had recent gastrointestinal surgery or chemotherapy. About 80% of time, C. difficile associated diarrhea occurs in patients who have been taking antibiotics for several days, but it can also occur in several weeks after treatment is completed. The severity of a C. difficile diarrhea and colitis may vary greatly, ranging from mild diarrhea to a more severe colitis or to toxic megacolon, which can result in sepsis and death. Symptoms may include frequent loose stools, abdominal pain and cramps, nausea, fever, dehydration, and fatigue. Patient may have blood mucus or white mucus cells in their stool and frequently have leukocytes. While some cases of a T. difficile diarrhea and colitis do not require treatment, others require specific oral antibiotic therapy. Most patients improve as normal flora re-establishes itself, but about 20% of the patients may have one or more relapses, with symptoms and detectable toxin level re-emerging. Sample required. A fresh stool sample is collected in a sterile universal container. Normally, it is not required.